rupturing pregnancies, infections that feel like you're peeing lava, and periods that basically cosplay as early labor. Today, we're talking about 5 more of the most painful things a female body can experience. All right, let's dive right in. Number 5, kidney infections, aka peeing fire. Let's start with something a lot of people know too well: urinary tract infections. On paper, they sound basic and fairly treatable. In real life, though, they can feel like urinating molten glass. A lower UTI is when bacteria, often E. coli, from the GI tract make their way into the urethra and up into the bladder. The result is that classic trifecta: burning when you pee, that feeling of you gotta go right now, and the joy of sitting on the toilet every 5 minutes only to squeeze out 3 angry drops. The pain isn't just at the urethra either. For many women, it's a deep, crampy, low pelvic ache plus pressure that makes it feel like your bladder is full even when it's not. Add in some blood in the urine for some patients and you've got a pretty miserable situation. But here's where it goes from this sucks to, oh, this is definitely an emergency. When the infection climbs up to the kidneys, that's called pyelonephritis. We're talking flank pain, sharp stabbing, or deep aching in your back just under the ribs, accompanied with fever, chills, nausea, and feeling like you got punched in the kidney from the inside. I have some patients describe it as someone taking a baseball bat to their side every time they move or breathe. Treatment depends on how far it's gone unchecked. Simple lower UTIs can often be managed with oral antibiotics, hydration, and pain relief. But painful kidney infections usually mean IV antibiotics, fluids, anti-nausea meds, and sometimes a hospital stay, especially if vitals are unstable or the patient is pregnant. And if a severe UTI or kidney infection is ignored long enough, the bacteria can enter the bloodstream, leading to sepsis, a life-threatening full-body reaction that can land you in the ICU. Pain scale-wise, a bad bladder infection might hit between a 6 or 8 out of 10. A full-blown kidney infection, many rank it at chart-topping right up there with labor contractions or kidney stones. Number 4, ectopic pregnancy and tubal rupture. Next up is one of the most dangerous and painful emergencies on the list. Normally, when an egg is fertilized, it implants inside the uterus, where there's space and a blood supply designed for a growing pregnancy. In an ectopic pregnancy, that egg implants somewhere it absolutely shouldn't, most commonly inside a fallopian tube, basically a narrow, delicate hallway that is not built for expansion. At first, symptoms can be sneaky. Maybe some light spotting, a little cramping that feels like a weird period, mild pelvic pain on one side. Easy to dismiss. But as that pregnancy tissue grows and stretches the tube, things escalate quickly. The pain can become sharp, one-sided, and deep. Some patients describe it as a knife jabbed in their pelvis or intense pressure that doesn't feel like normal cramps at all. And when the tube can't stretch anymore, it can tear or rupture. That's when things get really scary really fast. Blood starts pouring into the abdomen, irritating the inside lining and nerves. Pain becomes sudden, severe, and widespread. You can get shoulder tip pain from blood irritating the diaphragm, dizziness, fainting, and a rapid heartbeat as blood pressure drops. In the ER, this is a full-blown emergency. We're talking IV lines, fluids, urgent labs, pregnancy testing, ultrasounds, and often an OBGYN rushing in to assist. If we strongly suspect a ruptured ectopic, the next stop is usually to the operating room to stop the bleeding and remove the pregnancy, and sometimes part or all of the damaged fallopian tube. In terms of the pain scale, ruptured ectopic pregnancy is often rated as a solid 10 out of 10. Patients describe it as the worst pain of their lives, and the body knows something is very wrong. People often come in looking pale, clammy, and terrified. Number 3, pelvic inflammatory disease and tubal ovarian abscess. It's kind of like adding fire to your entire pelvic region and then trapping it in a pressure cooker. Pelvic inflammatory disease, PID, is an infection of the upper reproductive organs, the uterus, fallopian tubes, and ovaries. It often starts as an untreated STI like chlamydia or gonorrhea, but can come about following childbirth, miscarriage, abortion, or any procedure where bacteria can travel upward from the vagina. Early on, PID might look like vague pelvic pain, unusual discharge, spotting after sex, or low-grade fevers. But as the infection climbs and inflammation builds, the pain can become intense, deep, aching, and constant, often worse with movement, sex, or even just walking. If the infection keeps going unchecked, it can start to form a tubal ovarian abscess, or put it simply, a pocket of pus involving the ovary and the tube. That's when the pain level skyrockets off the charts. We're talking severe pelvic pelvic pain on one or both sides, fevers, chills, nausea, and feeling like your entire lower abdomen is made of one giant throbbing bruise. If you're driving to the hospital, even bumps on the road can feel unbearable. In the emergency department, we'll do blood work, pregnancy testing, STI testing, and imaging like ultrasound or CT scans usually first. If we find a large abscess, that's a serious situation because the abscess can rupture, spilling infected material into the abdomen and causing sepsis. So how do we treat it? This usually involves strong antibiotics, often IV, pain control, and careful monitoring. And larger or stubborn abscesses may need to be drained by interventional radiology or in the operating room. Pain scale for a bad PID flare or tubal ovarian abscess can easily hit 9 or 10 out of 10. Number 2, adenomyosis, also known as light labor periods. Most of us have heard of, or maybe some of you have even experienced, the pain of endometriosis. Endometriosis happens when tissue similar to the uterine lining grows outside the uterus, landing on places like the ovaries, fallopian tubes, or even the bladder. Every month, those rogue patches swell and bleed with your cycle, but because they're trapped in places with no exit, they cause inflammation, nerve irritation, and cramps that can feel like your whole pelvis is being squeezed in a vice. Now, back to adenomyosis. This is a different kind of monthly misery. Instead of tissue escaping the uterus, it burrows into the uterine muscle itself. So every cycle, that troublesome embedded tissue swells and bleeds deep inside the muscle wall, turning the uterus heavy, swollen, and unbelievably tender. Many describe the pain as deep, grinding, contraction-like cramps, almost like they're going into a mini pregnancy labor during every period. Women with adenomyosis often describe periods that are beyond bad. We're talking heavy bleeding with large clots, painful cramping that radiates into the back and down the legs, and a uterus that feels enlarged and tender to touch. Some say it feels like someone is wringing out their pelvis like a wet towel. And the pain isn't always limited to period days either. There can also be a constant dull ache, pelvic pressure, pain with sex, and exhaustion from chronic blood loss and anemia. Imagine trying to go to school or work while your body is essentially running a mini marathon of pain every month. Diagnosis isn't always straightforward either. Ultrasound and MRI can sometimes show a thickened, boggy uterus, but sometimes it's only definitively diagnosed after a hysterectomy, which is not exactly a first-line diagnostic tool. Pain-wise, many rank these cramps right up there with endometriosis, easily 8 to 10 out of 10. Number 1, degenerating uterine fibroids, often described as fibroid crisis. On their own, uterine fibroids or benign muscle tumors of the uterus can cause heavy periods, pressure, and pain. But when a fibroid outgrows its blood supply and starts to degenerate, that's when the pain becomes unforgettable. Degeneration happens when part of the fibroid doesn't get enough oxygen and nutrients. The tissue starts to break down from the inside, and your body responds with inflammation and pain signals that say absolutely not. Patients often describe sudden, intense pelvic pain that can be sharp, crampy, or constant and crushing. It may localize to one side if the fibroid is pedunculated, meaning it's hanging off the uterus on a stalk, or feel more diffuse, meaning spread out across the whole pelvis if the uterus is full of multiple fibroids. And that pain we speak of can be bad enough to cause nausea, vomiting, and difficulty walking. And laying flat might make the pressure worse. Some patients even feel a hard, tender mass in their lower abdomen, like a rock that hurts every time you move. In pregnancy, fibroid degeneration can be especially brutal because the uterus is growing and blood supply is changing. That can mean severe pain on top of everything else a pregnant body is dealing with. In the ER, we'll usually do imaging, often ultrasound to look at the uterus, measure fibroids, and see if there's any sign of degeneration or torsion. We'll also rule out other emergencies like ovarian torsion, ectopic pregnancy, or appendicitis because the pain can mimic those too. Treatment focuses on pain control, sometimes stronger pain meds, hydration, and rest. Pain score for some patients is a solid 9 or 10. It's not just a bad cramp, it's a deep, unforgiving pressure and stabbing pain that hijacks your entire day and sometimes lands you in the hospital. So there you have it, 5 more of the most painful, frustrating, and sometimes life-threatening things that can happen to a female body. If there's one big takeaway from both part 1 and part 2, it's this. Female pain is real. It's not just cramps, it's not just stress, and you deserve to be taken seriously when your body is screaming at you. If you winced, cringed, or had a flashback at any point in this video, go ahead and hit that like button for me. And of course, please make sure you subscribe, turn on your bell notifications so you don't miss a single video. Thank you so much for watching and stay healthy, my friends.